You'll never guess how I got these results that are lasting a year later to repair the volume loss and lip lines. I'm Dr. David Bushore, board certified dermatologist based here in Austin, Texas at Balcones Dermatology Aesthetics. This patient is 68 years old. So when people see this, if you're treating the upper lip, a lot of people see volume loss, wrinkles. I'm gonna do some Botox, some filler, and help repair, add that volume back. It can be tricky because Botox wears off. Filler, you gotta get that in exactly right. If you add too much, that upper lip gets heavy and starts to drop. I did neither one of those. I did a deep Phenol, Croton chemical peel. By doing that peel, the body creates that collagen elastin and it's in there forever. So it can last 20 years or more. Here's a close-up pictures. You can see how that skin is kind of sunken in and you got the wrinkles. And here it is, look at these are a year apart. Here's the other side, you can see that there's volume loss, wrinkles, and again, a year apart. Close up where you can see that volume loss, those wrinkles. Here's the front view, you can see the wrinkles and the close up. And the cool part too is I didn't peel the pink of her lips, but you can see just with that skin tightening, it helped the volume of her lips. It kind of opened that up and made those look better too. Here's what you need to know if you're planning on doing this. This is what that chemical peel looks like the next day. So that's what it looks like the next day. Here it is 10 days later and it's healed, but you can see it's still pink. So you can't cover that with makeup and things. But if you're willing to go through something like this and be healed in about 2 weeks, you can have results like this that last. The only downside could be my problem because then you're not coming to see me for Botox and filler anymore. So if you're interested in this peel, come see me at Balcones Dermatology Aesthetics.